my patient today. I'll be assessing the quadriceps reflexes, the spasticity of the wrist flexors, and I'll be discussing the lateral corticospinal tract. So the first test on the reflexes of the quadricep, I have the patient with the leg stabilized at 90 degrees. The upper leg is stabilized and the lower leg can hang freely. I'll be providing a brisk tap at the quadriceps tendon to elicit a deep tendon reflex. So I'm going to give you a brisk tap here just below your kneecap. You shouldn't feel any pain. I'm going to support the upper limb and then give the tap. So that was a normal grade. I would grade that at a 2+. If there were no knee extension, that would be a grade of 0, and trace would be a grade of 1+. The next test we'll do is the spasticity of the wrist flexors. So I'll have you have a seat right here, and we'll support the arm just so that the muscles are completely relaxed. To begin the test, I'll hold at the bony landmarks to not give too much input to the muscle spindle, and I'm just testing the available range of motion. Okay. The next component to the test is giving a quick stretch. So, explaining to the patient, I'll give you a quick stretch and you shouldn't feel any pain. The spasticity is normal, so I would give the patient a grade of 0 on the modified Ashworth scale, which means that there is no spasticity present. If there was spasticity, grade of 1, you would see a catch or a release and on less than half of the available range. Next, I'll be discussing the lateral corticospinal tract and its pathway. The upper motor neurons begin in the primary motor cortex and from there descend through the internal capsule to the cerebral peduncle, and from the cerebral peduncle descend to the anterior pons down to the medullary pyramids, where most fibers desiccate or cross, and from there descend to the lateral portion of the ventral horn, where they will either go to the distal upper limbs or to the distal lower limbs. The lateral corticospinal tract is responsible for fine motor movements, inhibition of the antagonist muscle movements, and for limb flexion. Clinically, if the lesion is above the level of desiccation, then we will see contralateral deficits. And if the lesion is below the level of desiccation, then we will see ipsilateral deficits. Here are the deep tendon reflex grades and the modified Ashworth scale grades.